So I'll go ahead and do the honors. First of all, I want to say thank you for each and every one of you for being here and for having an unbelievable AEP. It was by far our best AEP ever. So I want to congratulate you guys on. I know we're still getting numbers coming in. It was the last 4 or 5 days from what I heard from Integrity and the carriers was by far the best 4 or 5 days I've ever seen in history. Matter of fact, United, God bless United and their organization family. I'm sure you guys heard about the CEO of United being gunned down last week, but United had their all-time best year ever. I think they had over 2 million new enrollees and just to a United alone, 2 million. And most of those sales came that final week. So it was a huge week. And I know many guys capitalized on that. Talked to many of you guys throughout the week and your texts and your calls. I appreciate that. The stuff that we've been sharing has been working. And I mean, there's people that were getting in 8, 9, 10, 11 sales every day last week. And it was cool to see that. So I'm looking forward to seeing those numbers post. Michael will have the most updated leaders board Friday. We'll review and acknowledge some people today. On the current one, but it was so amazing to see so much activity that final week. So thank each and every one of you guys for making it happen. And the main thing, we made it happen for our clients. That's why we do what we do. It's about changing and saving people's lives and making a difference in the communities that we serve. That's what it's all about. The money's great, the commissions are great, the renewals are great. Everything we do, it's great. The co-ops and the extra and campaigns that we do. But ultimately, we're here to help those seniors out there that are lost in this little, not little, but this challenging world of healthcare. So I appreciate each and every one of you, the service that you've given to our communities. I know the good Lord will bless you in return. And today's meeting is going to feature a gentleman has been with us. Many of you guys know John. He's been with us since back in August of 2012. Has been a tremendous team member. Has been giving and works with each and every one of the organizations as well as building his own team. He started out with us as running our call center, and I remember when he first came in to interview back at our office in Owings Mills, and he looked at our call center. He said, just because you have a room with phones in it doesn't make it a call center. Because we didn't have a Dropbox, we didn't have a CRM system, we didn't know what any of that stuff was, and we were making it happen. But John helped us get into the new age of what a real call center was about. He's done everything from, working with operations, done our IT, ran the call center, just about everything. And in the main, and also while he did all that, he was building his own agency. John is also an integrity partner, by the way, if you didn't know that. He graduated from Towson. I know he spent some time at the Naval Academy. Really smart guy. He's got a degree in computer science. I believe he has a master's in computer science. He can probably correct me on that. But John's truly been an asset to our organization for many years. Today, he's going to talk to you guys about something that I think is important to everyone in this call about what to do in December besides cross-selling. We're going to talk about later that in the meeting, cross-selling. But there's some tremendous opportunities right now in the month of December for special election periods. And this year, there's been more opportunities for that than I've ever seen. And John today, John Gourdin, the president and CEO and founder of Sound Advice MD, Integrity Partner, is going to share with you guys how to maximize the opportunity for the month of December in regards to special election periods. Let's give it up for John Gourdin. John, you there? Is he there?
Yeah, he's there. He's muted. He's probably getting his
John, you muted.
presentation set up.
John.
Sorry about that. My mic
Good morning.
Button was covered up.
It's all right. Good morning.
Good morning, everybody. So
glad to have you, John. Glad to have you here.
Glad to be here. Let me share my screen real quick, and we'll jump right into it. All right. So I assume everyone can see my screen.
Yep.
All right. Outstanding. So let's jump right into this. So today, what I want to talk about is enrollment opportunities that are available to us right now from December 8th through the end of the year. I know it's been a grind. I mean, this has been an incredible AEP. And I think it's important to understand that, there's no reason to stop grinding though. Really, this 6 months of the year, starting in October of 2024 through the end of March in 2025, is the high power Medicare Advantage time of year. So yes, we have the holidays coming up. So this is the sweet spot right now. Between now and Christmas and that those few days after the holidays, there is still a lot of opportunity. And what I want to do is talk to you guys about some opportunities to have some laser focus on. So the key thing here, December 7th, obviously, is the end of the annual enrollment period. AEP ends. From December 8th through December 31st, there are still opportunities for people to enroll in Medicare Advantage plans that will go into effect the first of next year. Now, there's certain qualifying events those individuals have to have available to them to make enrollments. And what I want to do is talk through a few of them. And I'm not even addressing all of them because there's a lot of different circumstances that, a person moving, going into or coming out of an institution. There's a ton of life changes that can make them eligible for a special enrollment to make enrollment. I want to focus in on a couple of them. There's also 5-star plans that opportunity is available year round if there's a 5-star plan available in that customer's market, and also changes in Medicaid or extra help status. I say changes in. So in the fourth quarter, just to remind everyone, in the fourth quarter, if someone has Medicaid in 2024, they cannot use that as a special election to go into a plan that starts in the beginning of the next month. Now, if they have a change in status, they lose their Medicaid or they gain Medicaid, or the same for LIS, they lose or gain LIS, that's a qualifying event and they're eligible to make changes. But the special enrollments that I want to focus on, well, before I say that, you want to get familiar with all of them. I'm going to focus in on a couple of them. But if you go to Medicare.gov, another site I really enjoy, I think is very informative, is MedicareInteractive.org. There's a wealth of information. It's a website really designed for insurance producers or folks that work in the Medicare world. So it's not really for consumers. It's public, but it's really designed around folks that are helping administer or deliver Medicare benefits to customers. So it's a great learning tool in Medicare Interactive. Medicare.gov obviously is the holy grail of Medicare. You can get information there on the special elections as well. All right. But today, what I want to focus on is 3 primary enrollment options. One is planned terminations. Second is FEMA disaster special election. And the last one is chronic SNP, the chronic special needs plans. Okay. Now, as I go through this, if there's questions, by all means, if it's on topic, I'll be happy to answer questions. I'll leave some time available at the end, but I want to move through this because I know Tony and Mike have some other things they want to cover as well. So next thing, plan termination. Every year, carriers discontinue plans. This year has been no exception. In fact, there's been a lot of planned terminations this year. What does that mean? A customer's on Acme Insurance plan, and Acme Insurance decides that they are not going to offer that plan in 2025. So what that means is when 2024 ends, that customer is going back to original Medicare. So when they go to their pharmacy, that means they don't have Part D coverage. When they go to their doctor, that means that they don't have assistance with the cost share, that 20% that they have to pay that Medicare doesn't pay. They don't have anything to help them with that. As a result, from December 8th through February 28th of that time period, they have the opportunity to enroll in another Medicare Advantage plan. So for customers whose plans are terminated and will not exist for them in 2025, AEP is not over for them. In fact, their AEP continues on through the end of February of next year. So the key thing there is, one, looking at your own book of business. Okay, most carriers offer the opportunity for you to log into a portal and download or look at a book of business for your clients. And on that book of business report, typically it's going to tell you when the customer was enrolled, when their plan went into effect. And there's also typically a column in that report that says this is the termination date. And most of them have some ridiculous date, 50 years from now or something crazy because the plan is active. However, any plans that you see in your book of business that have a termination date of 12/31/2024, that means at the end of this year, that plan terminates and that customer is off on their own on original Medicare. Those are your opportunities within your own book because you're losing your renewals on those clients. That customer's losing their coverage, you're losing your renewals. Those are the people you have to go back out to and make sure that you talk to them. Okay. Now, inevitably, you're going to talk to other customers that are not your clients, but some of them may also be subject to the same circumstances. But you may not be familiar with their plan in terms of, whether or not it's terminating or whatever the case may be. Q1 Medicare offers a great tool that allows you to look up a plan. So you can put in the customer zip code. It'll show you every Medicare Advantage plan that's available in that market. And it gives you two comparisons that are noteworthy. For the customers whose plans are not terminating, it gives you a before and after. And I'll demonstrate it in a second. But it gives you, hey, look, this is what the core structure for this plan looks like in 2024. And this is what it's going to look like in 2025. The main thing that's going to show you is, okay, this is what the premium looks like. This is what the deductible will look like for the Part D. And this is what the maximum out-of-pocket will look like. And then this is what the formulary structure is going to look like in terms of the tier costs. Those are the main things. It's not going to give you a full line-by-line comparison year over year of the full summary of benefits. It's just giving you a snapshot so you have an idea of some of the major changes. Okay. Any questions so far? And Mike, if there's anyone chatting anything, if you don't mind.
Yeah, of course. I can moderate.
All right, perfect. Okay. Moving on. Okay, wait a minute. Before I get into that, I'm going to pop out of my presentation and I'm going to bring up Q1 Medicare so I can demonstrate what I'm referring to here. Let's go here. So Q1Medicare.com. Now, on the left-hand side, you will see MA plan changes 2024 to 2025. You click on that, it brings up this page. And someone give me a zip code. Anybody?
21207.
21207. Thanks. See, now I was going to give my zip code, and I was like, oh, let me get out of Maryland. But of course, someone from Maryland responded. Okay. All right. So 21207. So now I can search. So click compare plans, and it gives me got to pick the county. So this zip code borders both Baltimore City and Baltimore County. So I'm going to say, let's go with Baltimore County. All right, so now what it does is it gives you a rundown carrier by carrier of the plan. So for example, Aetna is launching a new plan. So it's saying 2024, this plan did not exist. In 2025, this is the core plan structure for their PPO that's being launched in this zip code in 2025. Now, this is a plan that does not have prescriptions. That's why you don't see the tier cost here. And you see the maximum out of pocket is $6,750. Now, it's worth noting, okay, do not rely solely on this information as far as the structure. Why do I say that? Because typically with a PPO, there'll be an in-network maximum out of pocket, there'll be an out-of-network out-of-pocket cost. Also, when you're looking at the Part D deductible, typically a lot of plans will offer an exception to the deductible if the customer's taking a tier 1 or tier 2 medication. Like they're exempt from the deductible if they're taking like a lower tier medication. This is not going to tell you that. So you still need to go to the full summary of benefits. But to the point of plan terminations, here you'll see a checkbox that says only show plans that are being discontinued or plans discontinued in 2025. So if I check that, and I don't know if there's any in this market, this particular zip code, but let's see what happens. So now it's letting us know, yes, there are. So the Aetna SmartFit HMO POS, okay, this is the structure in 2024, is not being offered in 2025. So I know that if I'm talking to a customer that has this plan, them saying to me, well, no, I'm happy with what I have. I don't want to change anything. They have to do something because things are changing. The plan they have will not exist next year. Same thing here. Care First, Blue Cross Blue Shield Advantage Core HMO. Okay, same thing, not being offered in 2025. So you can basically pull up if you're talking to a customer and the customer says, "Oh, I have Ultrawood." Okay, well, you want to have more details. You need to know specifically which plan they have, but this gives you a quick and dirty way to find out. Okay, not only what is that plan offering now, but what's it going to be offering in 2025. Now, in this instance, these customers, it looks like they're going to be crosswalked over to a new plan. So it's letting you know that this plan will not exist in 2025, but it's also letting you know that those customers are automatically, presumably, being crosswalked over to a new plan here. But they still have the choice to choose another plan if they want to, because the plan they're on doesn't exist anymore. They don't have to accept what the carrier is giving them. Does that make sense?
Yeah.
All right. Perfect. Any questions? Okay, I'm going to keep moving.
I have one. I'm sorry.
Okay, go for it.
What website was that?
Q1medicare.com.
Q1medicare.com? Okay, yeah,
Yep.
I tried that. Maybe I think I spelled it wrong. Right, yeah, that's the problem. Thank you.
No worries. All right, moving along. Okay, so again, that's a great place to go when you're talking to a customer that you're not familiar with the plan that they're on. You can get a quick snapshot of what it is, how it's changing. Because again, a lot of times you're going to hear from customers, and we're AEP's over. You've had these conversations. A lot of customers saying, "Well, I don't want anything to change," and they're not aware that things have changed anyhow. This is a great way for you to see in a quick snapshot some of the major changes. Moving on to FEMA special election. Okay. Now, so what is a FEMA special election? FEMA is a federal organization that is principal responsibility is helping American citizens in disaster scenarios. As it relates specifically to Medicare, the presumption is that if a customer is in a region that's been impacted by some type of natural disaster or other calamity that would involve FEMA, that it creates a disruption. And there may be potential for those individuals to not have had an opportunity to take advantage of special elections that were available to them at that time. So to give you an example, a customer lives in a flood area, okay? Well, they're fighting for their life and their life and their property and everything else. They don't have time to get on the phone and talk to someone about their Medicare Advantage plan. So what FEMA is doing is giving them an additional opportunity to utilize the special election that was available to them at that time. So anytime there's a special election for FEMA, it's going to let you know when that event period began and when it ends. In some cases, there's an ongoing opportunity. So as long as that customer had a special election during that window, so let's say, for example, in fact, I'll bring it. I'm gonna come back to that. There's a couple ways you can identify FEMA special elections, and I want to use this as an example. I'm going to bring up the website and then just show you how to navigate it. So this is the FEMA website, and we want to look for disaster search, and I'm just going to focus in on 2024. Major disaster declaration, and it doesn't matter what type, then you can specify the state. So let's say Alabama is at the top of the list. So I can search. Okay. Now when I scroll down, oh, wait a minute. So it's saying there's none here. All right. Let's try another. Let's see what's next. Let's say Florida. I know they're going to have something. All right. So now it's giving a rundown of the FEMA special elections FEMA disaster declarations for 2024 in this area. So they got a couple of them. October 5th through November 2nd is the incident period for Hurricane Milton. Now, that overlaps AEP. That means that if a customer lives in this area that was impacted by Hurricane Milton, if I open this, if I click on this, it's going to give me specifically what areas, like what counties and so forth. So let's see here. Where is it? Giving that breakdown.
Try Pinellas County.
I'm trying to find the list. They normally list it. Oh, I guess it must be saying the entire state. Designated areas.
John, it is the entire state.
Oh, okay. Well, that's why. Okay. So,
You
so
want to
normally,
try?
like,
You want to try Texas because we had Hurricane Beryl, and not every county was in it.
Yeah, Mississippi is in the entire state. Louisiana's the entire state. Florida's the entire state. So some of them the entire state, John.
yeah. So that's why it's not breaking down a specific location. Let's try Texas.
My BSR for Aetna sent out some other Tennessee's, South Carolina, I think, because some of the hurricane and the flooding up there as well.
Yeah. There's like 42 states that have a special election due to FEMA. So there's a lot of them out there because of the storms and the challenges that everyone experienced from that. Go ahead, John.
Absolutely.
But Tony, does that mean that all the carriers are acknowledging this DST or just some of the carriers?
It's most, but that's why you have to check with each carrier. Some of them are on, most of them are honoring it. Some of them may not, but I would check with them. Most of them want to honor it for obvious reasons. They want more business.
Right.
Tony, I agree with you exactly, because I wanted to add and say to John Gourdin that it's real important if you are actually writing business and you're looking for FEMA, you need to really contact that carrier because specifically in the county that you're trying to write, because they can say no to you. So that's real important, Tony. Thanks for.
Absolutely.
Yes.
Well, that's a great segue into my next point. Checking with the carriers. So as an example, Cigna has a very good resource available that lets you know what special elections are available. If you go to CignaMedicareProducers.com, this is the same website you do your Cigna modules on. You go to the Resource Center. Once you log into the Resource Center, the first option on the right is going to show you SEPs, disaster, and emergency declarations. That'll be the first option. If you click on that, it opens a spreadsheet. It downloads a spreadsheet, which looks like this. And from that, you can filter by state. This lets you know from Cigna themselves which special election, which FEMA special elections they are recognizing. So I think we were talking about Texas a few moments ago. So if I search and filter just for Texas, it lets you know what the cause was. So this was the hurricane, there's wildfires. So there was a lot of stuff going on. Water supply, drought. And here, it lets you know what counties are impacted specifically. It lets you know the effective dates. So in other words, any SEPs available during this time frame from July 5th through February 28th, that customer has a second chance to use those special elections. And for each one of these, all they need is one. So there's a lot of different opportunities. As you can see, there's a lot of counties that are impacted. Harris County being one of our big opportunities with Houston. Let's see here. Like this one here, Hurricane Beryl. Harris County is covered.
Hey, John, let me squeeze in a quick question. On some of those special dates that, let's say, may have ended, isn't there still a window? I can't remember what that is. They got like a 60-day window after the SEP effective dates end.
It's 6
So
months.
let's say
It's 6 months.
Okay. So if it ended December 1st, you still got 6 months to roll.
Right. So what this is specifying is, hey, if they had a special election during this window of time, they don't have to use it during this window of time. They had to have a special election available during that time frame. So for example, well, this is a bad example because it's ongoing until February. But let's say this one ended at October 30th. Okay, it's now December. I can still use that FEMA special election because if the customer did not use AEP and AEP is in that window of time, if it were July 5th through October 30th, October 15th is in the middle of that, I can still use that special election as long as the customer has not used it. If they've already made an election for AEP, FEMA is not going to help you with that unless they have some other special. If they turned 65 or they moved or they lost coverage, there's some other special election that they did not use that they were eligible for at that time, FEMA will give you a second chance to use it. But if you've already used it, it's over and done. That makes sense?
So John, good morning. So
Good morning.
I know we in Illinois, we don't have it set up like all other states, but we did have some DST that ended November the 30th. So you're saying when you find a person that was not able to take advantage of the AP right now during the AP season, we can go back and use that SCP DST for them.
Correct. So what I'm seeing here is that in Illinois, severe storms, tornadoes, straight line winds, and flooding. For these, now it's for these specific counties though. So Cook County is in there, July 13th through November 30th. So since AEP is in that time frame, if a customer has not used AEP to make an election for a Medicare Advantage plan for 2025, they can still use it using this special election as long as they live in one of these counties.
Hey, John,
Yes.
just to clarify, there is a difference between the disaster time period and the special election due to the disaster time period, right? So the disaster time period for Hurricane Beryl, for example, was in July. And then the SEP for that disaster time, they're giving them, I think, 9 months. So it's from like the beginning of July all the way through February. So that change has to be made. It can't be made past February, right? We still have that disaster election period, but whenever that disaster election period ends, that's the last day to do it, right? You don't have 6 months after that. It's just the date of the disaster is when you're given that time frame, okay? So you see this time frame right here where it says SEP effective dates. That SEP effective date, that's the termination of the SEP effective date.
Correct. So if they have an SEP during this time frame, they can use it. To your point, there is an expiration on when you can use it. You can't use it a year later.
That's the expiration though, because the floods and all the winds and everything, that happened in July. So the SEP effective date, that is the termination of the effect. There's nothing after 11/30. Okay, so I think that's how it's set up on. Yeah.
Okay, and I do see here that they're saying that it's expired. So good catch. I'm glad you corrected me there.
Thank you.
And John, I just want to say, because I was thinking the same thing, because when they give you that termination date, the end date, you can't use anything. But I was a little bit confused when you were speaking because I enrolled quite a few people during AEP, did not use their AEP, but used the DST. So I was kind of wondering now, do they still, because at this point, because I used the DST, they no longer can use the AEP because that was over on the 7th of December. And they don't have the DST because it expired on 11/30. So therefore, they're out completely, correct? Correct.
And to your point, in either event, they would have been out because even if you used AEP instead of DST, DST was only giving them an extension on AEP if they hadn't used it. If they've already used it, it's done anyways.
But if they're going into a new Advantage prescription drug, they could use OEP then. Would that be correct?
Starting next year, yes, in January 1. Correct. Starting January 1, yes.
Right. So if I can just say the same thing in a different way, SEPs give an opportunity to enroll if you already have one. And basically, if you missed your chance to enroll because you could, this doesn't give you a chance to enroll because you couldn't in the first place.
Correct. It doesn't create a special election. It gives you an opportunity, a second chance at using an election you already had if you didn't use it. But if you didn't have an opportunity during this window of time, for whatever reason, it doesn't create an opportunity for you. That makes sense? So FEMA in and of itself, FEMA in and of itself does not create a special election. It's giving an extension on one that you already have.
So, John, if someone did not use their DST or AEP during that time frame, they are still able to enroll after November 30th or no?
No. So
Okay.
if you look at this chart, and I'll clarify because I misspoke earlier. So this is letting you know what time frame is. So this is when it began, and then this is when it's over with. So as of November 30th, they can no longer use it. And here Cigna is specifying that this special election has expired. So that they also give you that additional, hey, is this good or not? So for Illinois, as far as FEMA is concerned and Cigna, there are no current FEMA special elections available.
John, one other thing.
Mm-hmm.
As of January 1, 2025, the FEMA special election period ends 2 months after the declaration date. So they have made that change.
Correct. There's a couple of changes along those lines. Actually, I'm gonna circle back to those in just a moment. All right, so let's see. We're still looking at this. Let's move forward.
Hey, John, I got one quick question. If a person didn't do anything and just moved to the new plan, but didn't make an election, they still have an opportunity during OEP to change, correct?
Oh yeah, regardless of whether they did anything now or not, OEP
Right.
gives it, as long as they're on a Medicare Advantage plan, they have the opportunity to change plans.
Okay.
So even if someone made a change during AEP, they can still change during OEP.
John, I think you have to just make it plain. It has to be like plans. Or either you can go right back to Medicare Advantage and then you have to pick a standalone prescription drug plan. So
that's your original Medicare, you mean?
Yes, original Medicare, and pick a standalone prescription drug plan. So they must be like plans for OEP.
Right. Well, why don't we do this? Because we're talking about OEP now, and that's outside of the scope of between now and December 31st. That's a whole nother election period. But the point being, if you do talk to someone now and they do not have a special election and they are enrolled in a Medicare Advantage plan, you will have another opportunity. In fact, I have a slide addressing exactly that. Okay. So important notes here about the FEMA special election. You cannot use the FEMA special election as a part of a marketing strategy. So if you're talking to a customer and you're opening up your conversation, I'm sorry. So if you're opening up your conversation about them having a special election or a special opportunity because of a hurricane that is not compliant, okay, you can use whatever normal marketing you have. Hey, if you have ads running about, grocery cards, as long as they're CMS approved, those customers come on and they want to talk to you about Medicare Advantage plan, and they recognize that they missed the December 7th deadline. Hey, if they're in an impacted area and you're talking to them as a result of other marketing, that's fine. You can move forward. But we're not supposed to be using FEMA as an opportunity to market, and that should not be our opener when we're talking to a customer. Does that make sense?
Hey, John, before you continue further, that one slide you showed I gave you from Integrity from Friday's meeting, I just want to address that statement. If you can go back to that in the middle, the guidance on the CMS rule, I'm sure you guys have seen or heard about, they're going to change. CMS is deciding to change that after April 1st, SEPs can only be processed through Medicare Direct. They're going to eliminate the agents. That actually is being challenged by us at Integrity and others in the industry. So we expect that rule to be changed. And that just goes to show why it was, what happened with that ruling was so important that it was put on stay. And the new administration, which is very pro Medicare Advantage, unlike the last administration, this is going to be a huge opportunity. I believe that will be put on stay as well. So for right now, there is a CMS rule that after April 1st, SEPs can only be processed by Medicare Direct. They are trying to eliminate having agents utilize the special election period available through disasters or any type of emergency. But we believe, we're about 90% confident we're going to have that eliminated. So I just wanted to share that. We'll know more about that ruling probably come February, March.
Got it. Got it. Well, let's see here. Last couple of things here. Well, and we've already talked about this. Clients must have had another eligible enrollment period during that event period, and the enrollment period must have gone unused for them to have the opportunity to use it with the FEMA special election. Now, this is addressing the point that Tony just made, so I'm not going to spend time on this one. This is just elaborating. This is an extract from the CMS notification about the changes to FEMA starting in April. But to Tony's point, that's being challenged, and we'll know more about that in February. So
it's shocking, John. And part of these rules of CMS, you have 4 or 5% of the people in our industry that are pure knuckleheads. You guys know them. Agents that are willing to do anything, say anything, lie, cheat, and steal to make an enrollment. So over the years, they've seen a lot of people abuse the FEMA SEP, and they're penalizing the other 90%, 6% of the agents out there that are doing it right. And that's kind of part of our argument to the government, to CMS, about, hey, don't make this change because you're only hurting those that are doing it right. Let's eliminate those that are doing it wrong. Let's get them out of the business. But that's not penalize everyone else, because ultimately it's going to hurt the clients. And you guys know how hard it is to get in touch with the government as it is. Can you imagine thousands of clients trying to call the federal government, calling CMS, to get the help they need? It'll be a nightmare. They can't handle it. So just keep that in mind why they're trying to do that. Go ahead, John.
No worries. All right. So the last one that, again, and I want to emphasize, this is not the last special election available. It's just the last one I'm addressing here. The more static and more well-known and easily identified. Chronic special needs plans. So again, a chronic special need plan is a plan that's designed specifically to provide enhanced benefits to seniors that have specified chronic conditions. As examples, customers that have diabetes, chronic heart failure, COPD, end-stage renal disease, HIV/AIDS, and there's other specific plans that are out there. So the key thing here is you can go to any of the quoting engines available through Integrity. So Medicare Center, Medicare App, Medicare Link. When you're looking, you go through and you put in the zip codes and you specify the doctors and the medications and so forth for those customers. When you get the list of carriers, there's filters available where you can filter and say, just show me the chronic SNPs. Just show me the special needs plans that are available. And in that way, you can filter through. Now, I don't think any of them allow you to filter down and say, just show me the diabetic plans, or just show me the COPD plans or ESRD plans. It shows you all of the special needs plans, and then you just have to filter through to find the plans that offer benefits specifically for the conditions your client has. That make sense? Okay. Now, coming to the end here. Again, all is not lost. If you talk to a client and they're interested in a plan that you're presenting to them, but they just do not have a special election, bear in mind, OEP is like AEP Light. Okay, this is another huge opportunity for enrollments. So those customers you talk to now are the ones that you can build your pipeline for AEP for OEP. The clients during that time period can switch from one MAPD plan to another. They have to have a Medicare Advantage plan, though. If they're on original Medicare, it doesn't allow them to switch to Medicare, or to a Medicare Advantage plan. OEP runs from January 1st to March 31st. So again, I want to make sure everyone understands, taking the time to talk to customers now and finding out that they don't have a special election is not a wasted effort. You will have another opportunity right after Christmas to go back and help those customers. About a week after Christmas, you'll have the opportunity to go back and help those customers. Okay? Questions?
Hey, John. It's Chris.
Yes. Hey, good morning.
Yes, good morning. Hi, everyone. Just so I remember and I'm clear, that chronic SNPs can be done all year long, right?
Correct.
Okay, great. I just want to make sure. Thank you.
And John, you might, I don't know if you addressed it or not, because I know you share it a lot, but I don't recall you did, but the special election for the disaster areas, can you explain the aspect of, let's say, someone lives in Maine and they weren't affected, but they have, let's say, their mom or dad or their kids living in those areas. Can you explain that special part of the FEMA special election? Because I think that's important for people to know. If someone in their family is affected.
Absolutely. Yeah, that's a great point, and I did not address that. So you often have seniors that you work with that have as rigid or structured a relationship with someone. Like that person might have power of attorney. So the customer lives in one area, their power of attorney lives in another area. And let's say the client themselves does not live in a disaster area, but their trusted advisor lives in that area and that person is not available to them. That special election for FEMA applies to the senior if the person that helps them is impacted by the special election, because indirectly that client is then impacted by the disaster or whatever calamity in that area. So it doesn't have to be that the client themselves live in that area. If their trusted advisor, people that help them make their decisions, were impacted, then that is extended to them as well. Does that make sense?
Yep. It's an important note.
John, a question. You said, and I didn't know this, John, and I thank you for this information, but is it just a trusted advisor or must they be a POA?
It doesn't have to be a POA.
No.
Great. Thank you.
Could be their emergency contact person. Their daughter lives in Florida and she lives in Maine. And a daughter helps her make her decision. She might not have power of attorney, but she's her emergency contact person and her beneficiary. It handles all her affairs, pays her bills, blah, blah, whatever. Then that counts.
Oh, great. Thank you.
And that could be her sister, could be the sister. It doesn't have to be one of the children. It could be the sister. It could be anybody that helps them in regards to this situation.
Hi, this is Valerie Nixon. That's very powerful because oftentimes on our applications, it will ask us if they'd like to list an emergency contact, and it does say optional. So most people bypass that, but, is it wrong for us to encourage them to, put someone down as their emergency contact?
I think it's always important to do that, no matter what the situation, because they could be incapacitated, it could be an accident, it could be challenges. It's always good to have a second party to connect with. So I think that is important.
Okay, thank you.
John, there is a handful of things in the chat. I'm looking back from about 20 minutes ago. Just to clarify, when a plan ends, will the Medicare beneficiary have more than one change?
No. Directly related to the special election or a plan termination, they have a one-time change. Now, it does just so happen that there's an overlap of that election period. So it's just for someone that is losing their plan, they have a special election that goes from December 8th through February 28th. It just so happens that also is the time period for OEP. So they could, in effect, use the special election for their plan terminating and then change again during OEP if they so chose. They're using two different special elections to do so. That makes sense. And I see a question if they're on a PDP. So if you have a customer that's on original Medicare and has a standalone Part D plan, it does not allow them, OEP does not allow them to enroll in a Medicare Advantage plan. It's like plan.
Great stuff. Other questions?
SEP, right? Unless they have an SEP, then they can enroll into original then they can enroll into a Medicare Advantage plan, right?
Correct. They have some, yeah. So what I'm speaking to is specifically OEP. If they have some other special election, yes, by all means, that they're not exempt during OEP. But OEP in and of itself allows you to make a like plan change.
So, John, if they go from a Medicare Advantage plan and they decide in OEP they want to drop that plan and take original Medicare and enroll in a standalone PDP, at that point, are they allowed to go to a supplement plan if they can qualify?
Oh yeah, absolutely.
They can, right?
Yeah.
All right. Thank you.
Yep. I think the key thing there is qualifying, going through medical underwriting.
Right.
Unless they're in a guaranteed issue state.
Which is when their plans cancel or leave the state or stop giving service in their area, they have that guaranteed issue if they have that qualifying letter. And how that letter is worded is very important.
Yep.
Yeah.
And that cancels in the crosswalk. So if they're crosswalked, that guaranteed issue cancels. So if they are crosswalked into another Medicare Advantage plan, they do not have that guaranteed issue right.
I got you.
Oh, I see what you mean now. Yes.
Yep.
But I just had an issue where, and I know that we're getting close to the end, but I had a client who went to a nursing home rehab, and they kept her a long time. And they made her son the POA, and then told him to cancel her Medicare Advantage plan because they wanted her on original Medicare with a drug plan. And him not knowing what to do did that. And that disqualified her from going to a supplement plan because that letter was written that you voluntarily disenrolled when they could have done that.
Gotcha. Right. Yeah, because the guaranteed issue is really intended to be a help to folks that through no decision or fault of their own are without coverage. So it's trying to ensure that those folks are protected. Okay, so I know there's a lot more questions. What I would like to do is defer those to Wednesday's session because I know we're coming to the top of the hour, and I know Tony and Mike have a few other things that they want to cover here. So thank you again, guys, for great questions. And Mike, Tony, I'll pass it back to you.
Wow, that was impressive, John. A lot of great information, amazing questions. Can y'all give John Gourdin a hand, please?